For many men, waking up multiple times at night to urinate, noticing a weaker stream, or feeling a sudden urge to go can trigger immediate panic. The first thought that crosses your mind might be prostate cancer. And it's completely natural to worry when your body starts behaving differently than it used to. But here's what most people don't realize. The reality of prostate cancer symptoms is far more complex and often much less alarming than you might think. Today, we're exploring 5 surprising facts about prostate cancer symptoms that could completely change how you think about your prostate health. These insights come from Dr. Mark Garnick, a professor of medicine at Harvard Medical School and a leading expert in urologic cancer. Let's get to the truth. The silent disease. Here's the most counterintuitive and perhaps most important fact about prostate cancer. The most common symptom is actually no symptom at all. That's right. Most men diagnosed with prostate cancer, even those with advanced forms of the disease, are completely asymptomatic. They feel absolutely nothing wrong. No pain, no changes in urination, nothing. So how are these cancers discovered? Through screening. Specifically, through the prostate-specific antigen blood test, commonly known as the PSA test. This screening detects cancer in its early stages, often years before any physical signs would ever appear. Dr. Garnick emphasizes that this is the first thing he wants people to understand. Most prostate cancers are silent. They don't announce themselves with symptoms. This fact completely changes the game because it means that waiting for symptoms to appear is not a reliable strategy for early detection. Think about that for a moment. If you're waiting to feel something before you get checked, you might be waiting until it's too late. This is why regular medical checkups and conversations about screening with your doctor are so critically important. The cancer you can't feel might be the one that needs attention. It is probably BPH, not cancer. Now, if prostate cancer usually has no symptoms, you're probably wondering, what's causing those urinary changes that so many men experience? The weak stream, the frequent nighttime bathroom trips, the urgency? The answer in most cases is something called benign prostatic hyperplasia, or BPH for short. This is a non-cancerous condition where the prostate gland naturally enlarges as men age. In fact, BPH affects most men eventually. It's not cancer, but it does cause problems. As the prostate enlarges, it can obstruct the urethra or press against the bladder. This creates what doctors call lower urinary tract symptoms. You might experience frequency, urgency, a weak stream, difficulty starting urination, or that frustrating feeling that your bladder isn't completely empty even after you've just gone. This distinction is critical and should actually be reassuring. While those symptoms definitely warrant a doctor's visit, they're far more likely to be BPH than cancer. Your doctor will also check for other potential causes like inflammation of the prostate, called prostatitis, or bladder problems before making any diagnosis. However, and this is important, BPH is not something to ignore. It's a legitimate medical condition that needs proper evaluation and management. If left untreated, BPH can lead to serious complications, including kidney damage or a medical emergency called acute urinary retention, where you suddenly can't urinate at all. So, yes, it's usually not cancer, but it still deserves medical attention. The red flag pattern. While general urinary symptoms usually point to BPH, there is a specific pattern that can serve as a red flag for doctors. Understanding this pattern helps you provide better information to your physician. Doctors categorize urinary symptoms into 2 main types. First, there are voiding symptoms, which relate to obstruction. These include things like a weak or intermittent stream and feeling like you can't completely empty your bladder. Second, there are storage symptoms, which happen because the bladder becomes overly sensitive. These include sudden urges to urinate and increased frequency. Here's the key distinction. Men with BPH experience a mix of both types of symptoms, and these symptoms develop gradually over months or even years. It's a slow progression. But a red flag for possible cancer is different. It's when someone has storage symptoms only, without the voiding symptoms, or when urinary symptoms develop very rapidly, over just weeks instead of months. This clinical detail matters for you as a patient. When you visit your doctor, don't just report what symptoms you're experiencing. Also describe the pattern and how quickly they developed. Did they come on suddenly or gradually? Do you have trouble both starting and stopping, or mainly just urgency? This information gives your doctor powerful diagnostic clues that can help distinguish between a common age-related issue and something more urgent. Pain in unexpected places. When symptoms of advanced metastatic prostate cancer do appear, they often show up in unexpected places. Instead of pain in the pelvic area, where the prostate is located, men often experience pain in their back or shoulders. This seems strange until you understand how prostate cancer spreads. When prostate cancer metastasizes, it has a particular preference for bones. It often travels to the spine, ribs, and other skeletal areas. As Dr. Garnick explains, men show up with back or shoulder pain, basically pain where metastases grow near bone surfaces where nerves are located. This is why persistent back pain that's getting worse despite treatment should never be dismissed, especially in men of screening age. It's not about becoming paranoid about every ache and pain, but about being aware that bone pain, particularly in the back, can be a sign of advanced prostate cancer. If you're experiencing persistent, worsening back pain that doesn't respond to treatment, it warrants a thorough medical evaluation, including consideration of prostate health. Forget the classic cancer symptoms. Many people associate cancer with certain classic symptoms like extreme fatigue and unexplained weight loss. However, these are not signs of prostate cancer. Those general symptoms, fatigue and weight loss, are far more common with other types of cancer, such as colon cancer, lung cancer, and lymphoma. With prostate cancer, you won't see these symptoms unless the disease is extremely advanced and has spread throughout the body. This distinction matters because it destroys what I call the wait until I feel sick approach to health. Prostate cancer doesn't make you feel sick in the conventional sense until it's dangerously advanced. You won't suddenly feel exhausted or notice your clothes getting looser as early warning signs. This reinforces everything we've discussed today. The life-saving importance of screening over symptom watching cannot be overstated. By the time prostate cancer makes you feel generally unwell, it's often spread significantly. Here's what you need to remember. Prostate cancer symptoms are complex, frequently absent, and easily confused with more common and benign conditions like BPH. Relying on self-diagnosis or anxiously monitoring every minor change is both unreliable and unnecessarily stressful. Yes, urinary symptoms warrant a doctor's visit, but they're not an automatic sign of cancer. In fact, they're usually something much more manageable. The key insight here is that the most important symptom of prostate cancer is the one you can't feel. That's why the focus needs to shift from passive symptom watching to proactive health management. Have the conversation with your doctor about screening. Understand your risk factors. Know your family history. Don't wait for symptoms that might never come or that might arrive too late. Your prostate health deserves attention before problems arise, not after. So instead of waiting for a symptom, when will you start the conversation about proactive screening? Thanks for watching. If you found this helpful, please like and subscribe for more evidence-based health information. And leave a comment below. Have you had conversations with your doctor about prostate screening? Share your experience.